Yang Bahagia Datuk Haji Abdul Halim bin Hussein, Penang State Exco for Trade Industry and Entrepreneur Development, Datuk Sri Lee Ka Chun, Special Investment Advisor to the Chief Minister of Penang, Datuk Lu Lilian, CEO of Invest Penang, Mr. Jagan Anak Lalaki R. Subramaniam, Director of MITI Penang, speakers and moderator, Datuk, ladies and gentlemen, good afternoon. Let me begin by giving you a warm welcome to the EHS Control Plan and Procedure Best Practices Sharing webinar. This webinar is part of the Penang State Government initiative under the COVID-19 Employee Health and Safety Industry Advisory Group. This advisory group is chaired by YB Datuk Halim with appointed members from related stakeholders such as MITI Penang, Penang State COVID-19 Immunization Task Force, Penang State Health Department, Department of Safety and Health Penang, Invest Penang, PDC, FMM Penang, CRES, Intel, Motorola, NI Malaysia, and AMS Osram. Thank you for attending the session. My name is William. I will be your MC in this webinar. The objective of this webinar is to share on the best practices of the COVID-19 control plan and procedure adopted at the multinational factories in Penang, general procedures and details example of control such as various controls, self-test mechanism, incident management, etc. will be shared and discussed later. Some house rules before we start. The webinar is recorded and will last for 2 hours. By default, all audience will be kept muted. If you have any question to the speaker, please type in the Q&A box. Before we start, please allow me to spend a moment to brief on the event flow and introduce our speaker lineup. We shall start with the opening remark by Datuk Haji Abdul Halim bin Hussein, Penang State Exco for Trade, Industry and Entrepreneur Development. Next, we would have Dr. Gunan from Penang State Health Department JKN to update on the COVID-19 situation in Penang. Moving forward, 4 industry experts from the multinational will share on the various topics under the best practices of control plan and procedures. After hearing from the expert, we will proceed to a discussion moderated by technologist Ashar Muhammad Nayan, the Regional Managing Director of MSDS Asia Sdn Bhd, where we will have additional panelists to join us later. Once again, if you have any question to our speaker during the session, please feel free to type it in the Q&A box. Please be reminded to post only questions related to today's webinar and no marketing on product or services is allowed. Without further delay, I would like to invite YB Datuk Haji Abdul Halim bin Hussein, Penang State Exco for Trade, Industrial and Entrepreneur Development to give his opening remark. Over to you, YB Datuk.
Thanks, William. Okay, thanks, William, and very good afternoon. Assalamualaikum. YB Datuk Sri Lee Ka Chun, Special Investment Advisor to the Chief Minister of Penang and Director of Invest Penang. We have also with us here Yang Bahagia Datuk Lu Lilian, CEO of Invest Penang. Distinguished speakers, panelists and moderators from the federal and state agencies, Intel, Osram, NI Malaysia, Motorola Solutions and MSDS Asia Sdn Bhd, members of the COVID-19 Employee Health and Safety Industry Advisory Group, captains of the industry and business communities, members of the media, distinguished guests, ladies and gentlemen. Again, a very good afternoon to everyone. Now, first of all, I would like to welcome everyone to our Enhanced Health System Control Plan and Procedure Best Practice Sharing webinar today. And I would like to commend CRES and its members, and also our Secretariat, Invest Penang, for putting up this effort and this webinar today. Now, this webinar was organized with the key objective of sharing some of the best practices of COVID-19 control plan and procedures adopted at multinational factories in Penang, together with real-life examples and practical procedures, act as educational and additional reference to the SOPs published by MKN, the National Security Council, MITI, the Ministry of Health, and other authorities. This webinar was proposed during the launch of the COVID-19 Best Management Practice by YB, our Chief Minister, the Right Honorable Chow Kun Yeow, on September 6, 2021, with the valuable content of which was compiled by CRES together with their members from the manufacturing sector. Today, I'm pleased that the key contributors, Intel, Osram, NI Malaysia, Motorola Solutions, and MSTS Asia are gathered in this seminar to share their best practices. I believe this session will benefit the participants in terms of SOP interpretations, especially for small, medium enterprise, smaller companies without in-house enhanced health system personnel. Now, as we all know, the manufacturing sector or industrial sector has been singled out as the contributor for the spread of COVID-19 virus, but it's not all. And here today we'll have the sharing of these companies that have led in terms of curbing the spread of COVID-19. Now, the Penang state government has also taken the initiative to set up the COVID-19 Employee Health and Safety Industry Advisory Group, COVID-19 EHS IAG, to create a network of employees, health and safety experts to gather knowledge and opinion from the manufacturing industry in Penang on COVID-19 related matters, exchange knowledge and expertise support for companies in the manufacturing supply chain in developing, implementing, and managing COVID-19 EHS control plans. The network has also served as a channel of communication and consultation between the state authorities and industry on COVID-19 control plan and procedure. We have also invited today MOH, or here we call it Jabatan Kesihatan Negeri Penang, to update us on the overall COVID-19 situation in Penang. With the collective efforts from various federal and state authorities, industry players, and community, I am glad that we are now seeing a decreasing trend in the daily new cases. While Penang's ICU utilization rate is still considered average, it was used to be high, but it is now stabilizing and at a managerial level. This best practice EHS control plan is not only meant for Penang industries, it is meant also for the whole SMEs of Malaysia. And I believe CRES and its members are committed to hands-holding follow-up after this event to assist companies to implement this EHS control plan SOP best practice. Now, ladies and gentlemen, in the recent announcement by the Prime Minister, crossing state is allowed, rentas negeri, we are now allowed to travel within the state, and I think all welcome this announcement. And almost all of the sectors are now, the economic sectors now are now allowed to operate. And we are looking at normality of the business, people who go back to work. But then we must not forget that the COVID-19 is still there. It is now, we have to live with it. It is now an endemic, but then we hope and we pray together that this new norm and normality would come back soon. So with that, I would like to all of us to stay safe, patuhi SOP. And last but not least, I would like to express my gratitude to all speakers who spend their valuable time to attend this sharing session. Without further ado, let's hear from the speakers today. Thank you very much. Assalamualaikum.
Good afternoon, Datuk Halim, Datuk speakers, panelists, organizing committees, and all participants. Okay, today I'm going to share our contact tracing procedures. So how we manage to do the contact tracing for all employees, and also, as you're aware that Osram, we have multiple buildings. So how we track people from building to buildings. Okay, in summary, in terms of contact tracing, so we start with people who are positive or close contact. So meaning that based on the statistic that we saw just now in the earlier presentation, so we see that we have more cases, okay, in Penang, especially we're afraid that not, because now we have no travel restriction. So therefore, we hope that we have less positive and close contact people that we need to do contact tracing. So, but nevertheless, if we have to do contact tracing for positive and close contact, okay, so we need to have a contact tracing process. Okay, but before that, before we go to contact tracing, straight go to contact tracing. So basically, we have to identify our employee category. So in which category they are. Okay, so with that, we can do contact tracing. So after that, we have to define the risk level. So which employee at what category. So this will help us in terms of testing. Okay, and also when we do the risk level, so we also have to inform MOH if, okay, from our contact tracing from employee who are positive, okay, so then we will have close contact people that we have to inform MOH. And after we do the testing, so if we found someone is positive, also we have to inform MOH, and if they are negative, they are allowed to come back to work with a certain control procedures. So meaning that in summary, so we have a positive people and close contact, and we try to get all the people in various category, okay, that have a contact with positive people, close contact people, and okay, we have to assess their risk, test them, and end up with either we surrender them to MOH because they are positive, or we take them come back. So meaning that all people who in the contact tracing, we have to know what is their status. Okay. So how we define employee categories in Osram? So we define category A for positive employee. Okay. So those who are contact with category A, we call it category B. And those who are contact with category B, we identify them as a category C. Okay, so this is very important later on how we're going to do testing, contact tracing, and so on. Okay, so once we have identified their category, then we will start our contact tracing. So in Osram, how we start contact tracing? So basically, the company, okay, Osram don't know if, okay, the employee did not tell us. Basically, as we say that, as we see from statistics just now, sporadic case, we have 40%, nearly 50% of the case in Penang is sporadic. So therefore, so employee have to report to Osram Healthcare if they are positive, okay, through test external, okay, not tested by Osram, or they have contact with someone who are positive, meaning that they are category B. So this is important of employee category, either category A or category B. So when they report to Osram Healthcare, so Osram Healthcare will get their information detail, okay, and then will forward to the respective department, okay, to do the contact tracing. So to do the contact tracing, our healthcare will provide the detailed information and also the link to contact tracing software, okay, so that we can identify where they are and so on. So when the respective department receive the email, then they will go to the software and start the contact tracing. So how to start the contact tracing? So when they go to the software, when they open up the software, basically we use a very simple software, okay, Microsoft Power BI. So the first thing that they need to do is they enter our employee number here. So this is our employee number. So from the employee number, next is they have to install they have to identify the date. So basically when we do for 14 days. So meaning that we have to type date here, 14 days. So from this, you already roughly know that how many people in the plant that contact with this guy, and then how many people in the shift and in the production. So, and number 4 also, you know where is this employee go, okay, which turnstile that he already scanned. So either in another building or in the same building or in the next door to cafeteria or anywhere, okay. And to zoom down detail, okay, for example, you can check he is in which section. So when you check all this box, okay, so it will end up with the list, okay. So this is the list, we say that possible close contact in production area. So this is the list that later on, okay, that you will do in detail, okay. Or either you want to call the positive people, the category A or category people to do further investigation, or if not, you already have the list with you. So in terms of people who are close contact with possible close contact with the people that we do contact tracing. Okay, so then what do you do? From the Power BI, you download the list, the employee list just now, okay, into the Excel. So basically you can see here, we have a lot of things that we need to fill. Basically, some of them is PDPA, okay, but this will fill by our healthcare. It's not filled by productions. Okay, first thing, we have to identify the category. So remember, we have category A, B, C. So we have to identify their category and also put a risk level to them. Okay, secondly, we have to decide what test that we need to do for them. Okay, so this is where we identify the risk level, the category of people, and what test. At the end of the day, we need to complete this Excel, okay, to ensure that, okay, all the people has been identified and test. Okay, so this is the risk level for category A to B. So meaning that we have someone positive and we also have someone that is a contact to the positive people, positive person. Okay, so this is an example. So A is this lady and someone has contact with her. Okay, so first criteria that we use to identify the risk level. So we base on the MOH definition in terms of close contact. So those who are in this category, we consider as a close contact. We will take their name and we have to identify MOH. We have to notify MOH, send the name list to MOH, say that this is the close contact from the positive case that we have from category A. So this is category name. Category B, people who are identified from the contact tracing. So on top of that, as Osram in the task force, so we also decided that we need to put another criteria for category B to ensure that we are able, okay, to do try to screen more people that supposedly under category B. We hope that we don't miss someone in the category B, because this category B is very important because they are communicating or they are in contact with category A. Okay, then so we also go the next step. So basically some of the people, some they only do up to category B. But to be more on the safe side and to ensure that we try to identify more potential people so that we can test them. So we know that especially with the variants that shown by MOH just now in terms of Delta variants and so on. So this virus is very robust, very fast in terms of spreading and very severe. So therefore we go into category B to category C. So for category B and category C, the definition, the metric is not under MOH. This is what the task force has brainstormed. Okay, with the recent vaccination that we have. Okay, so we have classified into two categories. Either they are fully vaccinated or not vaccinated. So we also define the risk of category C. Okay, this category C is not have a direct contact with category A, but they have contact with category B. Okay, so we're afraid that if category B is positive, then there might be category C that is positive also in our premises. So this is why we try to get as much as possible, as deep as possible, people to be tested, to prevent from spreading. Okay, so this is one of the criteria. We see that we are meeting one-to-one. We have meal made outside. We have meal made in Osram. So we also have additional carpool, household, office partition. So we have people who are staying in the hostel. We have same block. So either they are category B or category smoking, surau, and so on. So this is how we put our people into category, and then so we put into this Excel list. So this has to be filled by individual department where they put category B, high risk, category B, low risk, and so on. So we have the list of people who are in category and risk. Okay. Then we also have a process flow in terms of how to test them, what tests need to be done. For, you can see we have category B, high, category B low, category C high, category low, and also you have green color where this is negative, and you have red color which is positive. So if they are test antigen, if they are positive antigen, they have to go for PCR for confirmation. Then if they are positive, then they have to we have to send to MOH. And we also have certain criteria for quarantine and also Annex 17B and so on. Okay, so this to justify them, okay, they are okay, and then they can come back to work. So with that, okay, we put the test to be conducted here based on their category and the risk level. So this will be put by our healthcare, and they will arrange for testing. Okay, so meaning that at the end of the day, we have total list that completed with the category and also what type of test need to be done. Okay, so after we carry out the test, then we get the result. If we found that there is a positive, then we have to submit their name, the details to MOH. Okay, then MOH will do all the necessary things with the positive employees. And then for Osram, as I mentioned earlier, so we have criteria, even though they are negative, we have criteria to ensure that if they are quarantined, if we need to quarantine them and so on, to ensure that when they come back, so they are clean. So in terms of COVID-19. So with that, so I end my presentation. Thank you.
Thank you, Mr. Azizan.
Yeah, Azizan, I have a quick question. So from your explanation, the whole system depends on self-declaration, isn't it? For example, if my family members has let's say it's a category A, then if I don't declare to Osram, then you will not know. You will just allow me into your facility, isn't it? That's one. The other thing is that, for example, I myself also don't know. For example, I go to a gas station or go somewhere else, I come in contact with a positive case, category A, but I don't know he is a category A, so I also don't know. So for these two types of situation, and if I were an employee of Osram, so how do you deal with that?
Okay, based on current situation now, so we have a very effective system under HYPE. Okay, so this is important where every individual now, when you go to certain area, so you have to scan MySejahtera. So we have some cases whereby our employee in their MySejahtera, okay, so we have orange and red color, whereby this employee is not allowed to enter the premises. So if you allow that, later on you will have warning from MITI.
Maybe Dr. Siri, I can add on to that as well. The other thing we do in Osram now is we're currently testing the employees 6 times per month. So they do 2 RTK antigen on site as mass screening, and they do 4 self-tests at home. So the 6 times per month testing gives us the data.
Okay, thank you. So in other words, your system is linked up with MySejahtera, or you will actually check the MySejahtera to see that whether I'm high risk or low risk. How do you do it?
We 100% check the MySejahtera before entry.
Yes.
Okay. Okay. All right. Thanks.
Thank you, Grant. Thank you, Mr. Azizan. Next, we would like to invite Mr. Varam Vadivilo, the facility manager from NI Malaysia, to share with us the safe work bubble with digital proximity tracker. You have 15 minutes and the floor is yours, Mr. Varam.
Oops. All right, Dato Sri, Dato, distinguished guests, fellow pre-industrial zone members, good afternoon, and I shall present on behalf of NI. And just for in case if you need to know, we are located in Batu Maung, and we've been here for like 10 years old. We are in the test and measurement industry. So I'm going to share with you today about the safe work bubble with digital proximity tracker and the tracing system. So I've got 2 parts here. The first part will be all about safe work bubble, how the problems, solutions, and challenges have been analyzed, and how we execute, and what and how we carry on with this program. And the second part is the digital proximity tracker, which will be talking about some wearable device, infrastructure, how this tool helps us in the contact tracing and data analysis, as well as this is a new tool that we're using. We also want to share with you some pros and cons. And of course, at the end of the day, I just share with you some of the FAQ that we have actually listed out. So the problem, how can we avoid internal transmission within cross-functional areas in the factory, knowing there are many, many different groups in the whole organization. And the other problem that we see is how to ensure that the positive cases and close contacts are contained within a defined area. So this is a problem. And we came out with some solutions. One of them is Safe Work Bubble. And the other one is we coupled it with the digital proximity tracker, the tool that we are using today. And come back to it, there is a challenge. What are the challenges? Efficiency definitely gets impacted. And we know that this bubble can only work in the factory. Why? Because as long as the employees are in the factory, it's well controlled, it's well synchronized. But the moment they leave, when they go back home, we do not know what they do and who they mix with and how they live their lives. But one thing good for us is that we kind of control the bubble right through the transportation. And the good thing is we don't have foreign workers, so we have one less to worry. That is, we don't have to worry about the hostel, right? The other one is the definitely, this kind of challenges when we implement such things, there's some cost to it. The logistics, infrastructure, which I will share with you in detail later on. And this also comes with enforcement. When we say enforcement, because when you want to comply something, you got to have enforcement. You know that we all have been enforced by PDRM, KKM, MITI, and various agencies do come and visit us. But similarly, when we want to implement such things, we need to enforce. And yes, we add people, we have security, we have added CCTV coverage just to make sure that compliance is always, being observed, followed. And how did we execute? So we had thought about a few ideas. We brainstormed and we came out with one of them is the safe work bubble. Basically, I think all of us have seen this before. The safe work bubble we actually adopted is a concept from MITI's Safe at Work. And we coupled it together with the digital proximity tracker, that is to minimize employees' direct physical contact. It's something like that. I'm wearing it. It's just basically a kind of a dongle that I attach it to my lanyard. This basically kind of helps us, and I'll give you more details later on. And this will help us to ensure that employees are kept within, employees are aware if they breach that 1 meter distance. And then also if there is a zonal breach, we can kind of trace, which I also will come to you how we create the safe work bubble. And how we split common areas. For example, we had to put in additional infrastructure setups. When I say common areas, means cafeteria. We have the toilets. We have to actually have, portable toilets to create extra zones. We have to create extra surrounds. And then we also have to ensure that there are places where our locker rooms are separated. So we have to kind of set up all this infrastructure. And also we have to come out with the staggering break times, where in order to ensure that each group does not, mix up with each other. And we created more, we split the cafeteria into 2 zones, and then we had many staggering groups. So with all this set up, and then we went on the execution. Did it help? And how did it help? Certainly, yes. It actually reduced cross-area contacts, internal transmission, and it actually minimized the stayaways. Can I give you an example? When we split into a bubble, and if that is a positive case in particular bubble group, then we are very clear that we can identify that particular group, and the stay away is definitely is less compared to previously. When the contact is so much that there's a lot of mixing with the entire factory office people. The other one is the concentrated and easier contact tracing with the help of the digital proximity tracker. The other advantage with this that helped us very much is now that we have created this bubble and we're able to zone it, if there is a problem, then you only actually disinfect the particular zone or this particular location, rather than setting up the whole getting the whole factory doing the disinfection. Well, did this help us in our business continuity? Certainly yes, because we kind of minimize the risk of shutting down the whole factory. Because if there is something happen, because we created the zones, we are able to actually only close or shut down, or at least suspend, for a day and a half or what, that particular zone, so that we can isolate and we can take the necessary actions. So I'm giving you a little snapshot of the entire layout of a factory. This is how actually we broke out. We had created the front end, back end, raw materials, finished goods, the cafes. We actually kind of break them into zones, and we actually had physical barriers. Of course, these are collapsible barriers, like using QR stands, so that this in an event of emergency, we are able to collapse it and evacuate. So we have actually created toilets all over the place. We had portable toilets. We actually created additional surrounds, of course, with tents, complete with ablution, corners. We created surrounds, extra surrounds, and the cafe we split into 2, and we have the staging areas. We created additional staging areas. This is where you end up with some inefficiencies. And this is at the entire whole place. That's how we manage the zone. And we, of course, the routing, everybody has got a routing. I give an example is, if people from warehouse, they go into the cafeteria, if they go into the surau, they are only within that zone located. They do not go and cross, they're not able to cross any of the zones. And if they cross, of course, there is a traceability with this tracker will actually tell us. Eventually, when we do analysis, we're able to track back. So I will just pause here for a while, and then just to give you a high level. But this is how we set up the entire factory, and so that every area has been identified and grouped with individual support functions as well, and so that they do not crisscross any of the zones. And when they go to cafe, if at front end goes, only front end goes, and then when they back, and then the back end goes, and then there is separate zones for the cafeteria. Right. Now I will take you to the second part of my my presentation, which will talk about the digital proximity tracker, which actually, as I think there was a lot of requests from many fellow industry personnel that to share this tool that we're using. We just started to use, probably is about a month and a half, and I can share with you some highlights. So the tracker actually is just like this. So it's a mini, and this is actually each employee wears a wearable. We call it minis to your lanyard or to your badge. Automatically, it records each interaction with any other mini within 1 meter of the wearer. This is customizable. You can customize it. You want it 2 meters. You can actually go to the system and set so that anybody that crosses within 2 meters, it kind of gives you an audible alert, and then will tell you exactly. There's a flashing will also give you an indication that, hey, I'm breaching that zone. But here we follow Ministry of Health guidelines, and for Malaysia, we're using 1 meter. So if a team member tests positive or is a close contact, a complete tracing history can be filtered and viewed by date and time of the contact, including duration of contact. We can actually set, is it 15 minutes, 10 minutes, 3 minutes, whatever. We can kind of filter them out. And as I mentioned, the LED indicator shows on when the close proximity interaction is recorded. There is some audible alert, which will beep upon proximity contact when I pass by within 1 meter. And within a few seconds, it kind of contacts, it kind of registers. But in the factory, maybe it is not loud enough. We are improving on that, but this really gives, in the office, is very clear. So all interactions are recorded, and it's reviewable, and it's reportable at any time. Just to give you a little understanding of the infrastructure, it consists of the hubs, the minis that I'm wearing, and also the other one is the beacon. The beacon is basically, it's like another mini, but it's located in special places like pantry, toilets, and in the meeting rooms, because these are the places that we are not very sure is confined space. If you are 2 meters, there's no connection, but the beacon will register that you have been in this location, and that will also help us. The beacon will also help us to identify whether we need to deep clean that place. When we disinfect, we know that these are the location that the positive employee has gone to. So it's basically AC powered. It's plugged in. It's all infrastructure with all of the factories. We have located them, including the beacons, and this all the data is encrypted and is stored in the cloud servers with military-grade encryption. It works on a GSM signal, so there is no GPS, so that is you're not being tracked. Okay, so this is just give you an example of how the layout is of all the infrastructure for the hubs in the whole entire factory. We kind of install them so that it takes care of all it covers the entire space, the entire campus. This is a dashboard. To give you a snapshot of the dashboard, this is how it looks like. If you look at this chart, actually it shows who are the persons that have been linked in particular group. They're like contact. When we contact trace, we can actually select the name. I'll go to the next slide to show you that. We'll actually plot out this chart to show who are the ones in this contact. Here is identified by numbers. You can actually assign by number, or you can assign by name and ID. We chose by name and ID. Later I can share with you. So it can give you, number of contacts per day and a total duration, average contact, 1 minute. I can select 2 minutes and see a number of contacts. Kind of give you any high risk users. So this just give you this actual data that I actually snapshot. I covered the names just to make sure that it's confidential. It gives you where you can search by employee, name or ID. You're able to select the history of contact tracing. Example, duration, days, 1 day, 2 days, 7 days. And the data is displayed in a matter of seconds in a table form or a chart. We're also able to export it to the data to a CSV file, like an Excel spreadsheet, so you can do it. So here it shows you the user, and the user, let's say Balram, and then the contacted persons. It'll display all. It will show you the date. It also will kind of display you the number of seconds the person or minutes the person have contacted. This is how the chart will show. Give you a good example is I can put into a table. Just now was a table, but this is a graph where it kind of show. I've actually shaded the names because of confidential. This is me. The right one is me. Actually, I put my name in, and then I kind of go and contact trace. I say I selected the date, 1 day. You see, I must be behaving very well because I just put 0 minute. This is less than 1 minute actually. It's a couple of seconds. I have this context, and the depth is 1. That means I can go for the first tier. That's what my fellow speaker, Mr. Azizan, was talking about. Category A, category B, right? So we kind of consider that this is a close contact to a positive is depth 1. Depth 2 will be the close contact. So we can display this slide. Will show either chart form, and I can go when I go into the second depth level, third depth level. This kind of a web chart will show bigger, and they also transfer into a table form and export them into a CSV file. So that's basically I want to share on that. But let's give you some pros and cons. Every new tool will have its pros and cons, and we will work with the supplier who's based in the US. We basically adopted this tool because we found that it is useful in our HQ in Austin. They already implemented them, and we kind of a benchmark, and we have deployed this in Penang. So it is data driven. It's very good. Instead of by memory, because if somebody is a positive case, usually we will interview, hey, who are the ones in the last 7 days, where you went and how long you spent time. I don't think we all can remember, 3 to 4 days ago, even last 24 hours. So this is data driven. Will give you faster turnaround in a matter of minutes versus the interview plus CCTV tracing, which sometimes I've used to our security team in the control room to get CCTV data to trace the positive case close contacts. It takes a day sometimes. It takes hours because you need to browse through all your, all your recordings to just see, and sometimes it's guessing. You do not know whether this person is close or distant. So that is one of the advantage for this contact tracing tool. And we can also use this for SOP compliance and monitoring. There's a lot of advantage on that. Well, cons, we think that we are still working with the design team because if you put in a handbag, if you put in a handbag or if you put it into your pocket, the sensitivity is low because this works on a Bluetooth, low energy. Some or other it doesn't connect, so it's expected to display it always outside so that it connects with the hub. Because as you connect with another mini, it captures the data, and then as you pass by the hub, it kind of downloads into the hub, and then the hub will upload into the cloud. That's how it works. So this is need to be slightly improved, and it's also how we wear it. Sometimes it's unable to capture other aspects, which is like in a confined room, as I mentioned. If you're more than 1 meter, it doesn't tell that another person was in the room, but the only thing where is through the beacon. So that's another contact tracing. We are making some improvements. The alarm is a little soft in the factory because the piezo is kind of designed to be very soft. It's waterproof, sealed there, so therefore it's kind of not very audible. But we're working on this. So I finished the second part of my presentation, but I'll give you overall. We come up with the FAQ, and this is how it is from the first part and second part. Is it 100% non-interactive between zones that I shared earlier? No, it is not, definitely not. Because manufacturing is a dynamic environment with multiple movements interaction. It involves both work zones and other areas. There is absolute minimum employee that has been allowed to interzone interaction where PPE is a must. For example, some engineers, maybe they're not in that particular zone, but we need them. Or like an emergency, emergency person like a chargeman have to be. or fire warden has to be, then it's okay. We give some exceptions, but of course we wear PPE, full face shield. We allow them to go in, especially the engineers to support. What is the most difficult task in maintaining a safe bubble? Breach of compliance. People, some or other, tend to say, hey, I need to go and pass these things. I need to go and collect this. They kind of forget and they just breach the zone. We need to kind of constant awareness, clear communication, and on the reasons of implementation. And we continue to tell people this is a new norm. We continue to educate so that they get understanding of why we are doing this. We made a little difficult in life because the flexibility of them is no longer there to their favorite location they want to go is no longer applicable to them. This is one of the difficulty we have.
Mr. Ram, we have last 1 minute.
What are the cons of implementing safe bubble? Well, it's loss of productivity efficiency, increase in operational costs. I shared with just now, we spend a lot of money on that. Less engagement and interactions, but it is also applicable for crisis management. But it's not sustainable for the long term. And lastly, does the digital proximity tracker help in the fight for COVID-19? Yes. Rapid and accurate contact tracing, analysis, and the right actions ensure business continuity. And we are very confident we can continue with this and mitigate the risk without affecting the business badly. Thank you.
Thank you, Mr. Ram, for the comprehensive and detailed sharing with the audience. Lastly, we would like to invite Mr. Solomons, the Managing Director from Motorola Solutions, to share with us the Being Height Alerts. You have 15 minutes and the floor is yours, Mr. Solomons.
All right, so YB Dato' Halim, Dato' Sri Lee Kachun, Dato' Lulu Lian, rest of the notaries, my fellow panelists, and of course, all the participants, my fellow peers in the industry. A warm greeting, very good afternoon to everyone. So I'm the last one to share a little bit of what we've been doing at Motorola Solutions when it comes to height. So generally the industry have been pretty nervous, if I were to call it, when we first heard about this height implementation. So I'm going to spend the next 15 minutes probably in two parts. One is the takeaway that we have extracted from a very good briefing that was done by MITI not too long ago. I think it was 2 months ago on the height implementation. And in that briefing, we also had one of the companies that was based in Selangor to share some of their most recent experience on height. And also the second part that I would like to share is on how learning from that briefing, how us at Motorola have put into play some processes to be able to be ready for this height, and how do we now plan to contend or even deal with should we be flagged by this warning. Yeah, so with that, let me move on to the next slide. So quickly, what is HIDE? So HIDE is an acronym that stands for Hotspot Identification for Dynamic Engagement. Yeah, so it's basically an early warning system to facilitate some preemptive interventions as that could be flagged as a potential hotspots. And so the root of the information that serves that determination by the HIDE algorithm is basically the COVID-19 test data that is being tapped on. And then what happens is that a layer of a machine learning algorithm that utilizes AI to be able to use this information that it comes real time and flag and be able to flag potential hotspots on a 7-day moving average. Yeah. Next slide. So the how part of it, right? So what is critical first to understand when it comes to the information that is being used by the HIDE? Like what I've said, it clearly used real-time data from all the COVID test information that is channeled through that system. So when height is being implemented, it's clearly targeted at the premises. So all of us have our own premises that we are in charge of. So clearly, what needs to be taken into consideration when it comes to on the how part of height is the fact that first is, do we have a confirmed positive case that enters our building, our premises? So we need to take that into consideration. Second is, what happens if a person that enters our building is actually waiting for a test result, and the test results can come later by the end of the day, and that result could in turn turn out to be positive. So actually this person could have entered our building at the point of entry, no gejala, we call it, nothing of a concern. But then because that person has taken a test prior to entering the building, and then through the time that's being spent in the building towards the end of the day, possibly it becomes a positive, and that becomes another information that is being fed into this AI algorithm that height uses. And lastly is what happens when someone enters our building and it actually takes a test on site, and then as a result of that test, when the result comes later, it's actually positive. So this is again within the premises, a person on the COVID status becomes a positive by the end of the day. So all these three conditions needs to be well understood for us to be able to develop a good way to be ready, and primarily how we can avoid being flagged for a height. The next thing that the way that how the height system works, like what I've said earlier, contact tracing. So within this information that it has, it's able to do forward tracing, right? So when you do a forward tracing, this action itself may reveal all the contacts that is known to have come into close proximity with this positive case. So that is forward tracing. And this system also takes into consideration and conducts a backward test as well. So a backward tracing typically will reveal who might have been infected that could have come into close proximity with this alpha case and caused that infection. So forward tracing, backward tracing, all of this information is being pulled into that big data analytics that is being done. And then this specific that is able to predict a specific premises that could be at risk becoming a hotspot over the period of 7 days. And then, of course, the contacts that are identified, like everybody understands. So My Sejahtera check-in is a primary use for that. So My Sejahtera check-ins is so important that it is relied upon in order to be able to provide that indication which person have entered into which building at what health status. Yeah. And so the way that the height works is it is able to flag potential hotspots. So they call large hotspots if they are able to develop a data point that suggests most likely more than 50 transmission are likely to happen because of that positive person that could have entered into that building. And then there's a category that they could deal and call it as a small hotspot if the prediction says that it is going to be less than 50 transmission based on that positive phase that could have entered that building. Yeah. So this is how that information is being developed, fed into the analytics, and then through that analytics, the potential flagging is being devised and communicated. And this is something that I thought it was very beneficial because there was a real company that shared the experience, most recent experience on how that company also being flagged by the height. So so I've removed the company's name because it is non-consequential, because at least we understand what has happened. So the day one, the company received this warning. I put it as a day one. And the warning basically related that, hey, Mr. Company, you have one high-risk individual who has checked in into this into your premises. High risk in this case is a confirmed positive. A confirmed positive has entered your premises, and because of this, X number of maybe 5 contacts exposure related in your warning to you. So that is the first warning this company received. So in that period of receiving that warning, this company namely has spent a lot of time actually looking at taking the full account of all the people who has come in, checking anybody who actually come in into the premises and tested actually with the positive health status, and they couldn't locate. So even though how hard they were trying, they couldn't locate because the warning doesn't specify the name of the individual or the contacts that are exposed. So by the time day 3 came, this company received a second flag, which is second warning. Again, saying that, you got X number of high-risk individuals have checked in this case, which was the same one. And then you have now a different number of contact exposures that you have. And throughout this period of time, this company have spent a lot of time in trying to find out where, who within that premises. And by day 7, they have received a final notification to instruct them to close. And they were actually closed for 3 days. So clearly, I think learning from this, and I went away thinking that we really don't want to be flagged in any way by the Hyde engine. So the question is, what do we want to do? So hence, let me go into the second part of my sharing. So first and foremost, the first thing that we did was to make sure our enhancement of our employee self-declaration. So again, we only allow low risk and contact casual yang tidak bergejala. So real contact casuals, those are the 2 statuses that we allow into the building. And we require all our people to refresh the MySejahtera status daily, because remember, the information that goes into the Hyde system is on a daily basis, or in fact, as a real-time input. And then we also make sure all people who exit our premise check out their MySejahtera daily, because why we think it's important is because if today the person has checked out and upon checking out any point forward, would the health status turn red or becomes a contact bergejala, you will not be traced back into the building in the time, because remember, the information that comes into the system has a lag as well. Obviously, when you're doing these first two exercise, anything of a status change, our HR team will be alerted, and the usual test, trace, and isolate action will be put in place. So at least at the point of entry, we're able to deal with this. And just as a note, Motorola Solutions conducts our employee self-test every 2 weeks. Let me move on to the next one. So how do we put our rationalization for the warning readiness? So we kind of put in 2 degrees of constraints that in terms of active measures and preemptive measures. So for the first warning, so we make an assumption, should we get the first flag? What are we going to do? So we said that we're going to be activating all the reactive and preemptive measures. So in that reactive measure is to basically enhance the access control, right? So now we certainly need to make sure that we do not exacerbate the situation by allowing any more new unknown cases coming in. So we have to pay particular attention to the entry and also to the exit of our people who are in the premises, and also immediately increase the test coverage for all of the people who are coming in from the day next, right? And then for the second warning, should we get it, how do we now activate even tighter measures where we increase the test frequencies, implement capacity control, and no more face-to-face meetings, and only in-room, in-house dining. So I'll go into a little bit more in granularity in the next slide. So for the first day, what do we mean by enhancing the access control? And let's not panic, I call it a soft lockdown to relate that this is not a hard lockdown, but a soft lockdown triggered by treating the risk of the following three group of employees and contractors that we have in the premises. So you and I know that the first set of people will be people who are already in the facility when we first received this warning, right? So what do we do then? So we have a specific flow to deal with employees and contractors. So let's say, what time is it now? It's 3:56. If I were to receive a warning now, we have a process flow that will take care of all the employees and contractors and how do we treat that as a risk. And then what do we do with the employees and contractors who have left the building, who came in the morning, who has left the building by 3:56? How do we risk treat this set of employees and contractors? So we have a second flow to govern that. And of course, what happens to an employee or a contractor who wants to enter the building at 4:30 p.m. in the afternoon? So we also have another risk treatment for that group 3 and an appropriate process flow. So let me just go into the next slide. So this is the first one. So you got a flag, and then how do we treat the employees who are in the facility? The first thing we're going to be asking them is immediately, wherever you are in the building, immediately refresh your MySejahtera status and upload into the cloud your screenshot so that you'll be able to determine any of our employees have most recently experienced any health status change. If the health status changes, then our engine of test, trace, and isolation will kick in. So if there's no status changes, you are still remaining as good as a low risk or just a casual contact, then what we will do is we will issue exit granted email that will allow you, because we are already in a soft lockdown. That means the security doesn't allow people to come in, doesn't allow people to leave the building unless you are granted that exit upon you uploading your health status. So when they are leaving the building, the security will check, will make sure they check out and in their MySejahtera app, and then review that exit granted mail before they are allowed to leave the facility. So that is a group 1 flow. So for the group 2, right? So people who have exited prior to the warning. So what will happen is security will be able to provide the name list of those employees and contractors. They will be channeled to the respective managers for them to be able to contact. And the managers are expected to get these people, contractors and employees, to immediately update their MySejahtera status and upload the screenshot from wherever they are. And if their status remain low risk and casual, no problem. If their status changes, again, our engine will kick in for test, trace, and isolate. So it is very important that they do the mandatory checkout. So at the point of them being asked to do the status check, if they have not checked out from the building, we make sure that we ask them to do so. Yeah. And lastly, the group 3, people who wants to enter the building once we've gone on a soft lockdown. So what we do is this time, you can enter the building, but we do ask you to do a self-test immediately. And then if your self-test is proven to be negative, then you're allowed to come in, upload your test result, and as an evidence as what we are doing today, and then you proceed to enter the building. And then when you're about to leave, you'll be given an access, again, upload your status on your health status. Let's say you enter 4 and you want to leave at 7 in the evening, do your MySejahtera update, status update again, and again, you'll be given the exit allowance once your status is good, and then similarly as what I've shared before, you're allowed to leave the building. Next is what do we do? So first day upon receiving the warning, we have gone through this 3 process flow in processing these 3 groups of employees and contractors. So how do we prepare for ourselves for the next day of operation and with the window of day 2 to day 7, right? Remember, the height has a moving average for the 7 days. So clearly, we want to make sure that we increase our test coverage. So for day 2, all employees who are coming in will be required to do a 100% self-test so that we know we are starting with a great hygiene of people who are coming into the facility. So as usual, they'll be uploading the test results, similarly as what Intel had shared before, and with that they'll be able to come in and again, before they leave, they got to make sure they update the MySejahtera status and before they're allowed to leave. If there's no further warning till day 7, then we'll actually go back to the normal access and exit control prior to the warning. Yeah. So God forbid, but should we still receive a second warning anytime between day 2 to day 7, then clearly we got to do something more drastic in terms of tightening and taking control of our premises. So this is where we will shift gears into the capacity control and increase test frequencies. So only business critical employees and contractors will be allowed to the facility, right? So we have our determination of what are the business critical environment employees and contractors. Typically is between 30% as a rule of thumb, but it could deviate depending on that day, on the day that we receive. But we have a good guidance of how do we actually qualify business critical. So we will move into the business critical mode, and that means you have reduced number of employees coming in, and we will perform daily self-tests. That means employee who are reduced number of employees coming in now have to perform a daily self-test before they come in. And of course, there's no face-to-face, only in dining. And if no further warning we receive, then we'll resume back to normal access and exit. So I'm not talking about the flag, the third flag, because we don't want to talk about it if you follow these two process flows that we have. Yeah. So with that is my last slide. I hope I've been able to share at least what we actually have rationalized and have implemented here in Motorola Penang. Thank you.
Thank you, Mr. Solomon, and other three speakers for sharing your precious knowledge and experience with the audience. We will now proceed to a moderated discussion sessions. Our moderator for this session is Technologist Azhar Muhammad Nayan, the Regional Managing Director of MSTS Asia Sdn Bhd. On top of the three speakers in the earlier sessions, we would like to invite another two panelists to join us. They are Mr. Jagan Anak Lelaki A. Subramaniam, Director of MITI Penang, and Mr. Grant Brownlee, the Managing Director from AMS Osram. Participants who have further questions, please feel free to type your question in the Q&A box. We will try to answer the question before we end this program. Over to you, Mr. Azhar.
Okay, thank you to the organizer for having me as the moderator today. Datuk Sri, YB Datuk Halim, Datuk, and to all distinguished guests, industry captains, and also all the speakers. So I think it's a great honor to be here, and also it's kind of very interesting to listen from the experts today that I would say the focus mainly utilizing a lot of new technology, especially the digital stuff, as well as what most important is how do we process a huge amount of data, so that we can take real-time action, and also processing those data into a more meaningful information. So I would like to relate back to the topic of our discussion today, which is EHS, control plan and procedure best practices sharing. And we have already, I would say, got a lot of new inputs on how the multinational corporation have utilized the new technology to mitigate the risk at their workplace, especially in the manufacturing sector. But today we have audience from various industry. We have 200 over participants as of now, and 60% are actually from the manufacturing, where are the rest from the rest of the industries, mainly from the SMEs. So I would like to encourage the SMEs to ask more questions so that we can actually get a meaningful discussion. But I'll divide this into 4 areas. One is basically we look at a policy, and after that we move into more on the management approach by each of the industry captains, especially from the from the multinational corporation. And I think something that probably trigger all of us is what exactly the outcome of all the actions taken. How do they measure the effectiveness of every action that being implemented at your workplace? And finally, what are the key lessons learned? Either is positive or negative, and how do we prepare moving forward, because the virus is continue to be around us, as we know, and also the testing is just a containment action that we have to take, and what's next, So we have less than 30 minutes, so I would like to start with the policy or the standard, and as we already heard, various companies practice different kind of, I would say, approach, and also, of course, is governed by the national, what I call it, SOPs. But I would like to ask our first speaker, which is Mr. Jagan from MITI, what are the latest, from policy point of view, from MITI's point of view, in terms of any standardization moving forward on all these best practices on reducing the risk, and also at the same time, we need to assist the industry players, especially the SMEs. In Penang, we have 4,000 SMEs compared to 400 plus MNCs. So how do we share all this across all different industries here on all these practices, but looking at the policy point of view from MITI? So I'll pass over to Mr. Jagan.
Okay, thank you, Mr. Azhar, for the question. Actually, it's a very long one. I'll just brief it very quickly. Okay, as we all know that we are moving from pandemic to endemic phase, but it hasn't been announced by the PM. So actually, there's a way forward. There's a plan ready policy matters done by MITI HQ. In this sense, is involving a lot of not only MITI. We are looking into inputs from the foreign countries are doing and practicing, because we have MITI officers everywhere, but nothing can be announced yet until PM make an announcement. Then MITI will announce the policies on way forward . But what I would like to emphasize now is on, because since a lot of if you notice these past 3 days, a lot of ministries start to announce already that CIMS is no more required, especially for the construction sector, then the KPD and HCP for the retailing, then even the latest is from MOTEC, the tourism sector, that CIMS is not required. But for MITI, for manufacturing sector, as at this time until now, I have checked with MITI HQ, it's still needed. CIMS approval letter is needed. But one good thing is for, mostly us in Penang, which we are under the National Recovery Plan Phase 2, we are allowed to operate. There's a list of essential and non-essential list. So that's why for Penang, all the manufacturing sectors company need to refer to the SOP from the MKN, National NSC, this Keselamatan Negara, regarding involving Phase 2. So to be quick on that, there's two policy actually you can use. One is the Phase 2, but I think for manufacturing company, there's one good thing that we about the vaccination. If you update your vaccination accordingly, so if you are achieving more than 80% vaccination, you can override whatever phase you are in. That means you can operate at 100% capacity. If you have 40% vaccination rate, you can operate at 60%. So this is will override the Phase 2. So this is the thing that I'd like to request everyone to grab this opportunity, because we are in Phase 2. If you are in Phase 4, you're not focused on this, okay, never mind. But by vaccination, this one, making sure 80% you can operate at 100%. And CMS letter is still there. So when the MITI side, until a new SOP comes out from MKN about the no requirement for CMS approval letter for manufacturing, it will be announced. But until now, the latest SOP MKN, if everyone is confused, there's a lot of version coming out. Okay, nothing much change. The latest one is dated 11 October, but it's only the part that changed is actually, if you look into it, is only the Rentas Negeri, the cross state. The others all still remain the same thing, like Mr. Solomon just now, the My Sejahtera need to be, checked, the status, My Sejahtera status, then all the bi-weekly RTK antigen test, which I have, we have been getting a question, do we need to continue or not? Yes, everyone need to continue the bi-weekly data. It's just, you have to keep the report in whatever format they have, different company have different style. But then upon inspection from the SOP task force, it will be looked into. Or normally we get a complaint from the staff itself, if positive, then the company asks them to still continue to work, then the enforcement team will come down. So everyone just follow the SOP MKN Phase 2 and the vaccination update at the CMS as well.
Yeah, thank you very much, Mr. Jagan. I think you have also answered a few questions from the audience related to the CIMS, where I think that there's a latest update, as of now. Okay, I would like to move to the next area of focus, which is in terms of the management approach, because we are talking about EHS. It's kind of like, especially among the SMEs, yeah, EHS is pretty kind of common function, yeah, in the company. But I believe in the MNCs, where you have bigger resources, bigger fund, yeah, to mobilize your task force, especially during the pandemic. So we would like to also understand how this being done, yeah, so that SME can learn in terms of the approach, yeah, and also best practices in structuring your organization, yeah, to focus on the pandemic through the mobilization of your EHS team. So this question will go to Osram, Mr. Glenn, yeah. What exactly you guys have done differently, yeah, comparing before the pandemic or pre-pandemic, during the pandemic that we are in now, yeah, in terms of the EHS management itself, yeah. Anything that you guys revise or change, yeah, to accommodate this during this kind of crisis period, yeah.
Okay, it's a good question, and it's an interesting comment that you make that if the perception is the MNCs have this huge EHS resource, it's I think if you were to ask Azizan, does he have a huge EHS resource in Osram, he would tell me a different answer. The difference in how the management has handled this pandemic is that the EHS crosses all the boundaries. You know, COVID-19 is not an EHS issue. It's a management issue, and EHS is one of the inputs. And I think if you ask any of the companies, this has been a time we've been through where EHS, security, production, everybody in the factory has had to take away that functional role and play across in anything they can come across. And our task force we have in Osram is about 18 to 20 people. It covers all the functions, and it's a case of everybody chips in where they can, and we develop the policies, and we keep the people safe. So, you know, EHS became everyone's responsibility. And I think I'd actually like to just refer back to the previous question on the procedures. One of the reasons why we had to operate in that cross-functional way is that there's no way that MITI or MOH can produce a procedure that you follow by the letter. Even trying to produce a procedure that we can follow inside one company is impossible without 1,000 questions.
Right.
So we've had to take the MITI and the MOH guidelines and procedures and use them to develop our own way of working and to develop our own procedures. And I think we see that in the 4 presentations earlier, where every company has developed something different, but it works. And that's the message to the SMEs and the other companies is, don't wait for MITI or MOH to give you a black and white way of working, because it's not possible. You pull your best people and find a way to make it happen.
All right. Yeah, thank you very much, Glenn. Yeah, moving on to the next question. I pick up some of this question from the audience as well, but I have to summarize it. Yeah, when we look at the sharing just now, most of the things are related to high-tech stuff, yeah, digital stuff. A few of the audience even asked how much it costs, who are the supplier, so probably we can share with them later. Yeah, but looking at the technology point of view, yeah, to Mr. Solomon, being in Motorola in the forefront of as a technology provider, yeah, we're looking at various applications like AI or even big data analytics that being utilized out there as of today. We understand that SME is much more behind, yeah, in terms of all this access to the new technology. So how do you see the efforts, yeah, from this pandemic that can enable us to bridge the gap? For example, there's all those technology available, you know, for SMEs to explore, you know, at a very low cost, for example, yeah. So anything that you would like to share, yeah? How do you think that we should bridge this gap in terms of the utilization of technology during this pandemic?
Thanks, and good question, Azhar. Certainly, technologies has always been looked at as being a great enabler. But technologies may not fundamentally solve the problem. The good thing about this topic of discussion is the fact that with this COVID situation that we are in, the basic tools that we need to have in the workshop is accessible to everybody. The basic tools that I mean is basically the personal hygiene, masking, and the physical distancing. So these are the basic tools and information that everybody is now equipped. And if you were to do these three things, you have a good chance of riding this pandemic in a good space or place. But having said that, we wouldn't be where we are today if everything is working out to the T. So having said that, as greatly as the sharing has been, we started with JS sharing some of these technologies that is being used. So you can look at how the self-test kit now is the problem of thinking, am I exhausting my 2 weeks? Do I have 3 more days to go? Do I have 5 days to go? It is being solved by the use of technology where the employee is just coming in and is showing, I got how many more days left. So this is simple exhibition, how the apps environment is being utilized very clearly, and how that is also being brought into an ergonomic display that is able to be displayed at a level of ease of understanding. So which is great. And as we all know, in these current times, physical distancing is being managed in so many different ways. And Balram with NI gave a great input about the beacons, right? Bluetooth-based solution that he has shared, which tracks or actually monitors the proximity of one another when they are wearing this dongle. That is Bluetooth-based, that is able to now that information is floated into a database, and that database is able to be driven by an engine that is doing the analytics and then displays the desired dashboard for you to be able to make real-time determination. And I love it when he says, I can actually play around with my proximity to understand how far and wide I can cast a net in terms of proximity. So these really are the typical, at this point in time, examples of how technologies is coming in to help in that respect. The other part of it is we do know for a fact that, for example, in Motorola, we are big into video analytics. So we have solutions that is able to give you the alerts by watching monitoring the footages from the CCTVs, from the video, and through that live streaming, they're able to track and determine the distance from one another and provide an alarm or a audio amplification whenever that proximity is being breached. And also, we're also developing the engine for recognition of facial features with the masks on, right? So, and that's the other one, because in this scheme of things, wearing of masks may be a protective phenomena. So what happens to all the technologies that was based on facial recognition? Would they be put in a cold storage? The answer is no. Now they are being evolved to be able to overcome masks wearing so that they can still retain all the necessary features to be able to provide a strong and accurate facial recognition. So these are the things that is coming in, but more accessible to us nowadays is remote learning, remote virtual meetings. And you have seen how, I love the backdrop that you have, Adha, because when the first screen background, it was static, right? It was dead, it was static. So people are actually working on those areas to make it even more compelling, even more embracing for the general public in that sense. So this is how technology clearly works and evolves in helping to make certain challenges a little bit more easy to navigate through. So, all these solutions that we spoke about is relates to cloud computing as well. So again, when I speak about all this, it requires some investment in the infrastructure as well. So coming back to the core, how accessible these solutions can be made to all the SMEs and the small companies. So again, it comes with informed choice that needs to be made. But it has to be built on the platform of what you can clearly influence and have a great control in. The good thing is the basic tool works, right? Physical distancing, personal hygiene, and mask wearing, that clearly works. So if you were to keep this, and then the challenge right now is it's not within the industry per se, because it's community spread. So now how do we now bring that attack plan into the community? How do we now combat it at the community level is going to be the key. And this self-test phenomenon that we have all embraced is going to be setting us in a good stead, because end of the day is test, and more tests, at least at the community level, will give us a good level of hygiene for us to work with going forward.
All right, thank you, Mr. Solomon. Probably we'll have another platform, yeah, to share the updates on that latest progress of your new technology, especially for SMBs, yeah?
Right.
Okay, my next question will go to our expert from Intel, yeah, and also Mr. Azizan from Osram, talking about the facilities, yeah, control aspect of the facilities in terms of the air circulation and whatnot, yeah, because we are talking about one of the most challenging aspect of the transmission is airborne, yeah, especially in the manufacturing area that is very challenging also, yeah, to have that physical distancing, yeah, especially when it goes to high volume manufacturing. So maybe each one of you would like to share, yeah, what are the best practices within 1 minute time. Yeah, we don't have much time. Yeah, each one of you. So Mr. Tan from Intel.
JS, yeah, let me kickstart, right? I think if those that following the ASHRAE standard, right, the American Societies of Heating and Refrigerating and the air conditioners system, they have a professionals association. Right? What they recommend is for the air handling unit, right? They have their filtration efficiencies. If let's say you use that, they call it MERV14, right? It is a standard, a minimum efficiencies reporting values. So if we use that, I think that will at least filter out more than 90% of what we call our droplets. Droplets normally is about 1 microns. So what we are doing is like we replace all our filtrations to these MERV14 standards. So that at least will help on the filtration standpoint. Yeah, straightforward to answer.
Yeah, so that's something that Intel already doing it, or?
Correct, we're already doing it.
Okay, all right, great. Maybe we hear from Osram side.
Okay, as what mentioned by JS, so basically this is what recommended by ASHRAE. So this is more towards on the filtrations, but when we talk about confined space, aircon, and small areas and so on, so this is where I agree with Mr. Solomon. So the basic things, for example, like PPE, social distancing, you know, physical barriers. So this actually is a simple thing that we can do. Okay, on top of minimizing people inside the small room. Okay, so because we know that some of the things that we need to do, we have to balance up between profit, investment, and also risk, especially for the SME. So this is where we need to see what are the basic needs that we need to have in order for us to continue operations effectively. Okay, thanks.
Maybe in I can just add on.
Sure.
Here. You know, yes, I agree with that, Mr. JF and Azizan. Yes, we are following the MERV 14 standards as well. We changed all the air filters to meet that requirement. On top of that, we also added in the UV lights in just before the AHUs, so that it also helps in terms of taking off some of the viruses, bacteria, whatever is going to be there. And the other key thing that I believe in talk about air is the air exchange. We actually increase the air exchange more often than not. Yes, it's going to bite in your energy cost, but it takes out all the oil and brings so more exchange beyond the normal recommended standards. You will feel fresh throughout the day. I can bet you that. Yeah, it helps a lot. So that's one of the other things that that will help inshallah.
Yeah, thank you very much. Yeah, for that sharing. Yeah, I think we move on into, because we have only 5 more minutes. Yeah, just now we look at the contact tracing, at the safe work bubble system, yeah, modeling and so on. And now with the allowing the interstate travel, yeah, for everyone in Malaysia, especially those already been vaccinated. Will you guys need to remodel the whole thing and restructure or revamp the programming itself or the system itself with this? Are we ready and prepared for that? Maybe we work on the safe work bubble first from NI. You're muted.
You're asking me, is it Mr. Azhar?
No, with the government already lifted the interstate travel restriction, yeah. So your current system of safe work bubble that you shared just now, yeah. Do we need to remodel the whole thing, yeah, to cater for these new, I would say, new challenges, yeah, dealing with the employee who can move around, yeah, when they are off day, yeah, or outside from their work hours. So
yes,
need to do.
Yes, you're right. We need to take a look at it again. But as far as I mentioned, the safe work bubble works only within the factory. What happens outside is beyond our control. But it is part of an education and training to employees. They become more aware, and as they see the success rates, I mean, I'm proud to say that we are controlling it quite well at the moment. They see that the benefits of it, and when they go back, they have to kind of learn how to adapt. It's like a culture, right? You kind of inject that into it, and the behavior might help when they go back. Well, I know that they're going to travel with the opening up of all this. We have actually been briefing our employees. You can go, but still follow, observe SOPs, and please do report to us because we have guidelines too. If you attend a mass gathering, we have a guideline. You have to report to us, and we actually are requesting you to stay away. A certain number of days. We have local guidelines. This is just basically, stay a few days, then you do a test to make sure that the risk is taken off before we allow you to come in. So we are doing that. A mass gathering can be kanduris, can be weddings.
Yeah.
A lot is happening now when they go back to the kampungs.
Exactly.
We can see that is happening, but it's a continuous training, inshallah.
Yeah, I guess it's a continuous improvement needed as well, yeah, on the system development. Yeah.
Shall I add in something? So
yes, sure.
With the opening of traveling now, okay. So basically in Osram we have a system to monitor the risk level of every area in the production in the building. So every level and also every building. So meaning that based on previous 14 days or 10 days. So we can see what is the risk level of each and every level of the building area and also plant because we have multiple buildings. So from there, so we can assess our criticality in terms of COVID infection.
Okay, good. Yeah. Okay, just to wrap up our discussion because we're supposed to start at 4:30. Yeah. So that everyone can go back and do other works. So I would like to go through each one of you. Yeah, just give your short opinion. Yeah. If we could reverse, yeah, the time, yeah, and do better, yeah, what would be that one thing that you think we should do, yeah, so that we are more prepared for this pandemic? Can we start with Mr. Glenn from Osram?
Ask me that question, I've got to go first. It's not fair. No, simple. I think the simple answer is we would have started testing more sooner. I think we had no understanding at the beginning because. With hindsight, the cases last March were very low, but the reaction was very high. And now we're almost opposite now where the reaction feels low because it's normal, but the cases became very high. And the only way we got it under control was by testing. And yeah. I wish we'd done that sooner.
Yeah, we wish to have that self-test kit much earlier, yeah?
Exactly, that would have changed things. But hindsight is, and I think overall the industry and the country, but industry in particular has done a very good job given the circumstances.
Right. Yeah, great job to everyone. Yeah. How about you, Mr. Solomon?
Oh, okay. I certainly echo what Glenn have said. And quickly, the one thing, if in the rear view, that if I were to look at it again, is I think in some part, our operations have been victims of our own success. Meaning, we know for a fact that having the provisions for safe bubble is going to be key, right? Because that has all the hallmark bearings of how we can deal with this selectively and successfully while maintaining the operations that we run. But doing it is like all the cons or challenges that Balram has earlier highlighted. The victims of our own success is the fact that when we run our operations, we've learned over the years to lean out our environment to be as viable as possible. So when we are doing this at the optimum point, when now we are suddenly going into this safe bubble planning and all that, it requires redundancy to be built in. Else you will not be able to do this or provide that clear demarcation. So that would be one area I would look at. How do we not turn the needle of optimization and leaning too far extreme, where we find it very difficult to retract back if we want to put some smart planning and buffering for safe bubbles.
All right, thank you. Great. Yeah, next to Mr. Jagan from MITI point of view.
My point of view, I think, if we could only vaccinate it more faster, that could solve, I know 50 to 70% of the problem. But as we all know, we did our best because just to share, PICAS for the manufacturing sector, PPV, is the highest in Malaysia. We had 16 PPV operated, and we actually vaccinated around 257,000 of workers, involving 3,000 companies in Penang. Right? Sadly to say, Kedah, the biggest state than us, they only had 2 PICAS. But the only part that I regretted, we couldn't got the more vaccine supplies. Actually we were quite low during the August month. If more could have supplied, then we could have achieved more. But one part I am glad, because the PICAS helped the Penang state to achieve the phase 2 because of the number of vaccinated under the manufacturing. Actually, helped the KKM, in their peak as well to get the phase 2. Not much regret, I would say.
Okay. Okay, great. Okay, how about from Intel?
I would say that I think it's time for us to invest in the medical facilities. That's the key. I think you know that we have struggles at a point. So it's a time that can remember. I think it's a time for us to start to build up our medical facilities.
Yeah, agree. Okay, next to you, Mr. Azizan from Osram.
Okay, my point of view is same as Glenn and Jagan. So if we can reverse the time, so I would say that we have to test more, we have to test fast, and we have to vaccinate people as soon as possible. Then we go back to the current situation that we have now.
Yeah. All right. Thank you. Mr. Varam from NI.
Yeah, I think I add on to all of whatever has been said. I can say that I will go for the bi-weekly test. That is something that I believe gives you a confidence that you are safe to be on the site. That is more of an abundance of precaution. So I will follow that, and of course the infrastructure. We can set up the infrastructure and it go. We have like one-way flows and all that. So these are all limits a lot of things with the facilities. We can expand that. We are thinking of all that already, creating extra infrastructures. We do not know what's going to happen again.
Okay. Yeah, we don't know. Yeah, when it's going to happen again. Yeah. So yeah, I think that's about it. Yeah, due to the time constraint. So I would like to end our discussion today, even though it's short, but I guess there are a lot of things we learned. Yeah, from everyone, especially from the MNCs today. And I hope that MNC is willing to share all this. Yeah, some of this information more frequent with their SMEs through all kind of mediums. Yeah, from the state government point of view, from Invest Penang, or from any other agencies like MITI. Yeah, so that the learning curve will be much more faster for everyone to at least prepare for the post-pandemic, even though the virus is still around us. Yeah, but we know that there will be a lot more testing required. Yeah, a lot more contact tracing required, a lot more isolation required. Yeah, but we still need to maintain the supply of the operation side, of the business side. So there's a very challenging aspect of how you balance between achieving the goals, complying to the SOPs, the guideline, the regulation, but at the same time, meeting all your top line, bottom line, running your business. Yeah. So I would like to thank to all of these speakers, panelists today, yeah, from all the MNCs and all the audience. Those questions that we couldn't answer, we'll probably answer offline. Yeah. And some of those questions already been answered just now through the platform itself. So I'll pass back this to the organizer, yeah, for the closing.
Thank you, Mr. Asa, and all the panelists. So due to the time limitation, we will encourage those participants who have further questions or inquiry. Please provide your feedback by scanning this QR code on the screen or click on the URL in the chat box. Don't worry, if let's say you lost the feedback form URL, you can always go back to Invest Penang website in the event page. Once again, we would like to say thank you to YB Dato' Halim, moderator, speaker, panelists, and all the participants. I believe all the participants would already have a better idea about the best practices of the COVID-19 control plan and procedure after these sessions. So we would like to see you on next event. Goodbye and bye. Stay safe.